and good day. My name is Jürgen Steinmetz from eTurboNews, and this is a breaking news update. For more news updates and shows, please go to youtube.com/travel news group. youtube.com/travel news group. Here's our update.
Tourism and pandemics, do they coexist? It does not matter if your news source is social media, television networks, or print, the link between travel and tourism and pandemics is clear. If the world was not global, what started in China would have stayed in China. However, the virus spread because people move around the world by planes and cruise ships with a combination of land transportation options. Travel expedites the emergence and spread of disease. This dissemination has been the case throughout recorded history and will continue to shape the emergency, frequency, and distribution of infections to geographical areas and populations. What makes COVID-19 different from previous diseases in the speed and reach of the disease and the extent of the contagion beyond the traveler to the population visited in the ecosystem of the host destination? Disease spread is circular, with travelers sharing illness along their routes and encountering serious health risks that may be present in areas where accommodations do not meet global health standards and or practice inadequate hygiene and sanitation protocols. Been there. COVID-19 is not the first, and will not be the last, disease spread around the world through travel. In the 20th century, we have already witnessed many pandemics, including 1. Spanish flu influenza 1918-1919. 2. Asian flu H2N2-1957. 3. Hong Kong flu 1968. In the 21st century there have been 4 pandemics. 1. SARS 2002. 2. Bird flu 2009. 3. MERS 2012. 4. Ebola 2013-2014. Research suggests that the increase in pandemic outbreaks since 2000 is linked to the growth in tourism and global business travel. Mobilities is essential to epidemiology and the spread of disease. Travel is both a contributor to disease spread and its economic consequences are dramatically affected by it. The harsh reality is that we have no 21st century tools to fight COVID-19. The methods currently in place that attempt to cage the pandemic were used to control epidemics in earlier centuries and tend to be economically disruptive. With no treatment and the slow availability of vaccines because of the lack of global leadership and financing, combined with the fear that the vaccines are political statements rather than medical solutions, the world will be working with a virus-infused environment for years to come. Profits before people. While the tourism industry has been devastated by the COVID-19, leadership in the industry has been curiously silent. The business segment with the highest profile? Cruise lines. The executives have not apologized for playing a major role in transmitting the virus through their negligence and their head-in-the-sand approach to management. They have also ignored the thousands of passengers and staffers who are stranded at sea without any hope of getting off the ships and repatriated home. As of September 11, 2020, 300,000 seafarers were stuck on cruise ships without medical or financial assistance or the wherewithal to return to family and friends. Airline executives have worried more about Wall Street and their falling stock prices than trying to find and implement new technology, antimicrobial surfaces and improved cleaning techniques that could reduce COVID-19 particles from the HVAC system. The protocols required to keep sick people off their planes, providing medical care to people who are able to sneak onto planes, get sick and die, and alerting passengers about onboard pathogens from infected passengers, all these measures have been ignored. The executives are also silent about recognizing and rewarding good Samaritans who do the jobs that should be tasked to crew. The cruise line and airline industries definitely lead in the belief that profits are more important than people. Leadership vacuum. Should global leaders have been aware of the possibility of a pandemic like COVID-19? The short answer is yes. For many years, health and economic agencies and institutions have been warning of the increased imminent likelihood of a harmful global pandemic. The World Economic Forum WEF held meetings and had ongoing conversations with political, business and healthcare experts assessing key risks to the global economy. In 2006, during the first Global Risk Report, a pandemic was one of 4 key risk scenarios. It is curious to note that in the 2020 Global Risk Report, infectious diseases ranked 3rd in likelihood behind weapons of mass destruction and inflation, and 10th in potential impact and noted as one of the least interconnected risks. Why were pandemics moved to the back burners? The World Health Organization (WHO) initiated and coordinated the response to SARS through its Global Outbreak Alert and Response Network (DORN) in cooperation with its partner organizations that include 115 national health services, academic institutions, technical institutions and individuals. This public health network was originally developed to manage outbreaks of influenza and other infectious diseases, and it is now clear that multinational, collaborative, and coordinated surveillance, research and containment measures greatly limited the spread of SARS. The National Academies Press nap.edu/10915. Other global organizations have also raised warning flags and encouraged the development of preparedness for persistent virulent pandemics that makes international travel a personal risk and should be highly regulated to prevent the spread of these potential biohazards. However, leadership, participation and recommendations from the hotel, travel and tourism industries are absent from the conversations. Contagious and deadly. Although the world has lived through epidemics and pandemics, and COVID-19 is considered not as contagious as measles and not as likely to kill an infected person as Ebola, however, with COVID, people start shedding the virus several days in advance of symptoms. So, asymptomatic people transmit the virus before they know to self-isolate or take other measures, i.e., physical distancing, wearing masks, to protect family and friends. As of December 26, 2020, there have been 79.9 M cases and 1.75 deaths from COVID-19. nytimes.com/interactive/2020/us/New York coronavirus cases.html, and the International Labour Organization (ILO) predicted that 25 million jobs have been threatened by this new virus. Virus superspreaders. 1. Tourism is about movement and transportation and acts as a vector for the distribution of pathogens at regional and global ports. 2. Tourism is a major source of emissions of greenhouse gases and increases the risk of pandemics directly and indirectly. 3. Food production patterns assist in the spread of pathogens and contributed to the outbreaks of the coronavirus, SARS, and MERS, and industrialized food production has been linked to animal disease outbreaks. 4. Tourism-linked businesses source their food from global markets, preferably at the lowest possible costs, and, as they produce high volumes of the food waste linked to tourism operation, this sector is a critical vector of pathogens that make people sick and die. 5. Political instability and disease outbreaks can influence travel destinations, sometimes abruptly, in the hotel, travel and tourism industries are major players in the politics and policies of the communities in which they do business and yet remain silent on healthcare issues, sustainability, practices and procedures. Quality versus quantity. The success of tourism is noted by the growth in numbers, and quantity is used as a bellwether by UNGO, ICAO, CLIA and WTTC. Global growth agendas appear to be driven by individuals and large businesses profiting from growth models, specifically industries represented by ICAO, CLIA and WTTC, and encouraged by aircraft manufacturers Boeing and Airbus, as well as national DMOs and individual large tourism corporations. However, the growth model is not good for world health. Tourism and hospitality industries are viable when visitations increase, therefore, considerable efforts are made by decision makers to attract visitors to support the sector and enhance the multiplier effects. The ongoing health crises and its related travel restrictions on national and international levels has created a critical moment for the re-evaluation of the industry model. From travel bans and border closures to event cancellations, quarantine requirements and the fears associated with catching and/or spreading the virus, extreme challenges are evident. However, there is little evidence of leadership with suggestions for leading to a new and improved tourism industry. Do list. The current pandemic is an opportunity to reconsider tourism's growth trajectory and to question the logic of more arrivals implying greater benefits. The shrinking of the tourism industry sector is especially egregious because it generates foreign exchange, supports jobs and businesses, drives regionals development and supports local communities. Before the pandemic, the sector directly contributed 4.4% of GDP, 6.9% of employment and 21.5% of service exports in OECD countries, on average. In some countries the tourism contributions were much higher as a driver of economic activities, including France 7.5% of GDP, Greece 6.9%, Iceland 8.6%, Mexico 8.7%, Portugal 8.0%, and Spain 11.8%. Nations are being forced to rethink their entire economy, looking at new and unique ways to generate viable cash flows for their struggling economies. Not everything about the pandemic has been destructive, and there have been positive outcomes of the crises. As a result of decline in demand for flights, airlines have been phasing out old and inefficient aircraft, and carbon footprints have been reduced. In addition, the view of mobility has changed as countries without full lockdown appear to have seen a significant increase in cycling and outdoor activities, and video conferencing has reduced transport demand among business travelers and students. Innovative? Perhaps. Tourism in its current form is not resilient. Profitability and liquidity are often marginal because of overcapacity in air transport and accommodations, which can be linked to subsidies, market deregulation, and the disinterest of policymakers to address disruptive developments such as Airbnb. Unfortunately, the new normal will be an attempt to overcompensate for lost revenue, although global recession, depression, austerity will prompt for calls to cancel existing attempts to introduce model carbon pricing, sustainability, handicap accessibility, etc. Competition will lead to price-driven marketing efforts and not to the development of new and better products. Consumer behavior is being influenced by changes in personal economic well-being and disposable income, variations in the cost of living, perceived health risks, and new interests sparked by a year of COVID-19 and its attributes, i.e., quarantines, social distancing, illness, death. The tourism industry will be motivated by a desire to fill rooms and offset deficits, while consumers creating a disconnect between the interests of business and the target markets. It is likely that the tourism industry will revert to its previous mantra, heads in beds, and not listening closely to the traveler who has an increased interest in environmentally friendly travel experiences. McKinsey & Company, 2020. Rocky roads ahead. The Organization for Economic Cooperation and Development (OECD) estimates international tourism will fall by approximately 80% this year 2020, and there will be no meaningful recovery in international travel until late 2021. The UN World Tourism Organization (UNTO) does not see a recovery until 2023. The OECD projects the long-lasting tourism policies will include 1. Sustainability. This may become more important with an increased recognition of climate change and its impact on tourism. 2. Natural areas. Regional, local and rural destinations are likely to drive the recovery. 3. Drive distance. Shorter travel distances may result in reduced environmental impact. 4. Domestic tourism. Thinking global and acting local may increase, however, these tourists may be more price sensitive and have lower spending patterns. 5. Traveler uncertainty. Risk and anxieties may lead to a decline in demand and tourism consumption. 6. Traveler behavior. Changes in attitudes towards travel experiences may lead to new markets with a greater emphasis on safety protocols and contactless tourism experiences. 7. Safety and hygiene. Key factors in selecting destinations and activities that include health and well-being will include a focus on private rather than mass experiences. 8. Private jets/yachts. Health and safety concerns will increase in the use of private transportation. 9. Venture capital and investment. Reduced financial interest in the hotel, travel and tourism segments will continue through 2021 as risks and uncertainty continue to be part of the global marketplace. 10. Automation. Digitalization in tourism services with more technology, contactless payments and services, virtual experiences, and real-time information will decrease need for employees. 11. Tourism policy. Crises management will focus on quicker responses and require management and personnel to anticipate and adapt quickly to changes in business and societal environments. 12. Travel insurance. Travelers want to be assured that their plans are safe and protected, and purchasing insurance for travel will become part of pre-trip planning. The post-COVID-19 world for travelers will feature explorations of destinations that make it easy to social distance. Crowded markets, museums, concerts, hotel lobbies, airports, airlines, cruise ships, anywhere there are crowds will, at least in the short term, be no destinations. Itineraries will sidestep group programs where people are cheek by jowl on tour buses or waiting on long lines to visit a landmark. However, there will be increased interest in unique niche activities including bird watching, biking tours, and learning experiences, i.e., wine events, cooking classes, where people can easily be distanced from each other. There is pent-up demand for travel. Survival will be based on understanding and addressing the needs of the consumer, recognizing that, as Walt Whitman said, the past is prologue. Copyright Dr. Eleanor Garely. This copyright article, including photos, may not be reproduced without written permission from the author. #Rebuilding Travel.
Thank you for listening to our news update. There's more on youtube.com/travel news group, or you can read us, of course, in going to our news portal at eTurboNews.com or travelnews.online.